Hello. If you're watching this video, chances are you want to know more about oral chemotherapy. Many types of chemotherapy are given intravenously, meaning through an IV or by injection into your bloodstream. But there are types of chemotherapy that patients take in pill or liquid form by mouth in the comfort of their own home. They're just as strong and work just as well as cancer medications you receive at a hospital. But there are some key things you need to know about how to take these medications safely. You should go over all your medications, including all over-the-counter prescriptions, with your nursing or care team before you start oral chemotherapy. Be sure to tell all your doctors, including dentists, that you've been prescribed oral chemotherapy. Once prescribed, it is important that you follow the directions exactly when you take your oral chemotherapy medication. This means taking the right dose at the right time. If you do not take oral chemotherapy medication exactly the way your doctor tells you to, the treatment might not work as well, the side effects could be worse, or your doses might be too high from taking doses too close together. To prevent this, we suggest you use a diary to keep an accurate record of your doses and any side effects you may have. It's also very important to refill your prescription as soon as possible, since it may take a little longer to have it filled, especially if the prescription is coming from a specialty pharmacy. Oral cancer medicines are so strong that caregivers must wear gloves at all times when handling them. Make sure you throw the gloves away after each use. Patients taking the medication don't need to wear gloves since the medicine is going into their bodies. Keep the medication in the original containers you got from the pharmacy. It could be dangerous to mix the chemotherapy with other medications because it could be affected. Please remember to wash your hands before and after handling oral chemotherapy. Store the medication away from heat, sunlight, or moisture because exposure to these elements may degrade it, making it less effective. Follow the storage instructions on the container exactly. Always keep oral cancer medication away from children and pets. Here are a couple of important things to remember when taking oral chemotherapy. Pregnant women or women planning on becoming pregnant shouldn't handle these medications. When you go to the bathroom, flush the toilet twice after you're done with the lid down. If possible, use a separate bathroom. If you are sexually active, be sure to practice safe sex during your entire course of treatment and use barrier protection like condoms. Don't eat or drink grapefruit or any other product that has grapefruit in it. Grapefruit can prevent your body from fully absorbing the medication. And don't crush, cut, or chew your pills. Swallow them whole. If you have trouble swallowing medicine, be sure to tell your doctor or nurse. Patients who take oral anti-cancer medications may experience side effects, and that can affect your treatment. Side effects may include hair loss, skin changes like rashes or sensitivity, mouth sores, easy or unexplained bruising, feeling tired or fatigued, nausea or vomiting, or gastrointestinal issues like diarrhea or constipation. Call Fox Chase right away if you're experiencing a temperature reading of 100.5 or higher, flu-like symptoms like a fever, chills, cough, or a sore throat, shortness of breath, pain when you urinate, or blood in your urine or stool. That may seem like a lot to think about, but remember, it's very important that you talk to your team about your side effects. You must call your team as soon as the side effects start and not wait for the symptoms to get worse. In many cases, it's possible to reverse some of the symptoms if they're reported early. If you have any questions or concerns about oral chemotherapy treatment, please be sure to ask a nurse or a member of your care team. You can also refer to the back of our infusion therapy guide for patients to find our telephone triage line if you like to call from home. Know that we're here to support you and help you get the most out of your treatment. Thanks for watching.